that's kind of where you come in to be the kind of final solution to ongoing issues.
For a lot of people, it is kind of seen as the last resort. A lot of my clients, it's because they've been referred by somebody else that they know. I get quite a wide range of clients as well. I have sometimes see infants, and I see people up to sort of age of 97 and stuff. So I have professional athletes from different sports and stuff, and I've just general people that would be working in shop floors or garages. Now, you name it. I see people from all different walks of life.
Episode 30, and today we're with Marcus at Holistic Realignment and Physica. Marcus is a chiropractor and a realignment specialist based in Liverpool, who in the northwest of the UK is widely known as the Miracle Man, and in this interview we go into why. We discuss many topics in terms of holistic alignment, physical pains, headaches, aches, etc., and how he believes that he can reverse and fix these issues. We also discuss how the body can store emotions and traumas to cause ongoing chronic illnesses, and the work that he's been doing over the years to assist and help individuals to progress forward from childhood traumas and, you know, life's unfortunate circumstances which can materialize and manifest into all sorts of illnesses. So I hope you enjoy. As always, like, share, subscribe, please. Mark is taking on new clients always. He's incredibly busy, does have a long waiting list, but he will squeeze you in if you contact him. Yeah, I really hope you enjoy this one.
Right, so Marcus, thank you for joining me today. Do you mind just telling the audience sort of who you are and exactly what it is that you do for a living? And I was hoping that we can go into some sort of examples as to why your work is incredibly important for people with all sorts of different health issues.
Yeah, my name's Marcus Croman. I'm the owner of Holistic Realignment and Physica Limited. I'm a trained sports therapist. I started by doing sports massage and sports therapy, and then doing bits of osteopathy, physiotherapy training, some craniosacral therapy training, and various other modalities. And I've taken that whole training and produced my own techniques because I was finding that what was out there and being taught wasn't getting the results that I wanted to get for people for long-term pain relief.
Perfect. I don't know if you know this, but certainly people I've spoken to around Liverpool, they've referred to you as the Miracle Man. Did you know that?
Yeah, I get called all sorts of things like the magician and different things. Yeah, magic hands Marcus, and yeah, there's lots of nicknames out there for me.
All good ones, of course.
Yeah.
In terms of your sort of typical clients then, are we talking people that have had severe pain for long periods of times? Maybe they've done the circuit around physiotherapists and osteopaths, etc., and they've then found you, and that's kind of where you come in to be the kind of final solution to ongoing issues.
For a lot of people, it is kind of seen as the last resort. A lot of my clients, it's because they've been referred by somebody else that they know. I get quite a wide range of clients as well. I have sometimes see infants, and I see people up to sort of age of 97 and stuff. So I have professional athletes from different sports and stuff, and I've just the general people that would be working in shop floors or garages. Now, you name it. I see people from all different walks of life.
Yeah. What are the sort of typical things that you do see? I know that's a broad question because you probably see all shapes and sizes, but is there something that you immediately will look for if someone has, say, chronic neck pain that's been going on for years, or debilitating back pain? Or
so if they're having really bad neck pain, I'm looking for what's the cause of it, and quite often it's linked with the shoulders. So looking for if there's a discrepancy in the shoulder, if that's what's causing the neck. I'll be looking for the jaw in case the jaw is slightly out of place. Even if it's a millimeter out of position, it can cause horrendous neck pain.
Wow. So these are little subtle things that, you know, people just wouldn't know for themselves, would they?
Yeah.
Okay. Because I know I come to you, and I've spoke about this a lot on my podcast with different people I've interviewed. I was getting vertigo, and I was told by the osteopath who lives behind me that it's in my neck. I've gone around the houses with it, actually. It all started when I had a vaccine years ago, which is interesting. We had a bit of mold in the house, and then you look down that rabbit hole and how mold, you know, the mycotoxins can essentially like attach themselves to and overstimulate the central nervous system, keeping you in fight or flight, you know, giving you anxiety, etc. But when I come to you, you notice straight away that I was very much out of alignment. I think my jaw was out a bit, my hip was high on one side, one leg's longer than the other. You know, these are all things that I would imagine a lot of people actually have, and they're so subtle that most people wouldn't know they have these issues, and they probably wouldn't have many symptoms until maybe they're exposed to something in their environment, some sort of toxin overload or stress, or, you know, things like that. Is that something that you've come across a lot as well, as sort of a similar example to me, that can cause headaches, dizziness, and all of this?
Yeah, it's normally they've been living with something for a long time, and it's one little trigger that just kicks them over the edge that they can't manage that pain anymore and stuff, or they suddenly notice that they're getting pain there, and it can just be it can be something like bending over to pick something up sometimes, and it just triggers something, or it can be a sneeze. No, there's so many different things that can trigger the body into that response. It's very hard to pinpoint things a lot of the time.
So do you kind of overlook the outside noise and just get straight to, you know, the real sort of core reason as to why it's happening?
Yeah, I try and focus on what's causing the problem so that the symptoms can then disappear, rather than because I found that when I started, I was constantly trying to treat the symptoms, and people weren't getting any better. And I've discovered that if I actually find what's causing the issue and correct that, 90% of the symptoms usually disappear straight away.
Wow. Do you get a lot of patients that you'll fix and then they come back again, or are you literally one session, I'm the end of the line, go and live your life and hopefully I never see you again?
It's a bit of both. Some people want to keep coming along to stop themselves getting back into that state. Other people, I won't see them again until something else happens. And no, I'm happy with both. I'm not looking for people to come every week and seeing me.
Yeah.
To me, I'm doing something wrong if I'm seeing somebody every week for 6 months or whatever. I'm not doing my job properly.
Yeah, because I've noticed that a lot of other osteopaths or chiropractors, they'll set like a ongoing plan, and you do ask yourself, is it, more of a business model? Because your business model is great in the sense of what I found anyway, is it offers a solution, but it's probably not the best business model in terms of keeping people coming back and making an ongoing money.
Well, the thing is, what I found is that if anybody ever has come to see me and they've got a problem, I'm usually the first person they call to see if I can help.
Yeah.
So in that way, my business model works. No, and no, 99% of my business is word of mouth, and no, most of my clients will recommend at least 2 or 3 other people.
Yeah, so you're not capturing the same person on multiple visits. It's more, if I fix you, you'll tell other people, and that's kind of how we get that business.
Yeah.
Interesting. Okay, and does that make you think that, and I know we don't want to generalize, but these other guys out there, the chiropractors, the osteopaths, do they know what you know and they're prolonging the treatment for that reason, or have you tapped into something that's a little bit beyond what most people would conventionally would know?
See, I think I'm looking at the body in a different way than they are, because I see a lot of people that have been to osteos or chiropractors or physios before they've come to see me, and they've told the person of a problem, but they don't seem to know how to correct that problem, so they've just left it.
Okay. So their knowledge has gone almost as far as it can with this case, and now we're going to kind of
just continue treating the symptoms.
So what is it you know then? This is what I'm interested in, without giving all your secrets away. And I'd imagine the secret's so broad anyway, you wouldn't be able to just, tell the world in a 5-second soundbite. But how do you look at the body? How do you look at the body differently than your kind of average professional that's in your field?
Well, I'm looking for I'll notice the big differences straight away. So if the shoulder's out of position or the pelvis is out of position, even with clothes on, I'll notice that straight away.
Yeah.
But I'm looking for the very minor stuff, things that are only like a millimeter or 2 millimeters out of position. I'm looking to see what's causing that. Know what effect that's having on the body.
Yeah.
Seeing how the person's sitting, how they're standing, trying to capture as much information before they actually tell me what they're suffering with, or sort of. And it's also not doing the same thing for everyone. Everyone's body's differently. Everybody's body reacts differently. So if something doesn't work, I'm happy to try and create something on the spot, and for that person to be able to make that adjustment.
It's a very individual, holistic approach. And I know from working with you before, you're very quick. It's not like we're going to sit and go for hours and hours over notes. You're like, let's cut to it. Okay, I can see this, I can see that. Do you get this pain here? Does this happen? So you've it felt like you've already got half the picture already, and you just need me to fill in a few lines, and it's like, right, I've got this, and you know what to do.
I seem to be able to see where pain is, not just with my eyes, but with my hands as well. And my hands are usually drawn straight to where the pain is in somebody's body. And I'm quite attuned to that as well. So that helps me.
How do you teach that? Like, you're almost like, it's almost your own downfall, because you've learnt this yourself, and how do you teach feeling, and how do you teach to connect? So it must be hard for you to mimic that and build your business around people that you've trained to do the same thing, right?
It is difficult. I have managed. I've got quite a good team that I've been building over the last couple of years, mainly from students that have come to study with me from Hope University, and I've found it invaluable that they come and sort of observe me, and I'd start training them in the way I look at doing things, what I'm looking for in the body, what I'm looking to achieve. My goal is to try and fix everyone in one session if possible. I know it's not possible all the time to do that, but that's still my goal, no matter what state the person comes in to me.
Yeah.
So if I haven't fixed somebody fully in one session, it's down to me. I haven't done my job well enough. I feel quite bad for if I have to ask somebody to come back for another session. But I'm a realist. I do know that I can't fix everyone in one go.
Yeah.
But regardless of that, it's still my aim.
How do you turn this off when you're out and about? Because you said I can look at someone and like I'm thinking, how's he looking at me? What have I got wrong now? I haven't seen you in a few years. But how do you turn it off when you're out on the street and you see people and you're like, wow, your shoulder's out, your neck's out, or even worse, actually, when you see people in the gym lifting weights and you're thinking, all right, you're a disaster waiting to happen. Can you turn that off, or are you kind of always on red alert, scouring people?
Yeah, I can turn it off. It's quite difficult. No, I'll just look at somebody as I'm walking down the street sometimes and think they need to come and see me.
Really?
Uh,
Can't tell them that though, because they'll think you're a good salesman.
yeah. Well, it was. I remember one night. I went to a networking event and got chatting to this guy at the bar, and sort of he asked me what I did, and I just looked at him and told him all the things that was wrong with him, and he's like, "How'd you know that?" So I took a look at you.
What, just his posture is?
Yeah, just the way he was standing, and I ended up working with him for about 5 years. He owned a dental practice, and I worked in his dental practice, within his dental practice for about 5 years. So
is that how you learned a lot about the jaw TMJ and all, jaw alignment and stuff?
I'd done a client of mine from like very early on. He'd had his jaw dislocated and had been suffering from migraines for decades at this stage, and it was actually working with him and trying to create something to get rid of his migraines, because I worked out that it was his jaw causing it, and the jaw stability. So it was trying traditional methods of realigning the jaw, and that didn't work. So I developed my own technique by actually working on the jaw muscles of on the side that's affected, and letting the muscles realign the jaw, rather than physically trying to manipulate it, letting the muscles draw everything back into place. And it worked, and I thought it would have been a one-off case, but I've seen sometimes I see so many people with jaw problems, and they cause headaches, migraines, neck pain. So going back to your earlier question about neck pain, chronic neck pain, it's finding the cause and now if you find the cause and fix it, then you can treat some of the minor symptoms and it should all disappear.
Yeah. So he was a dentist and he didn't think himself, maybe my jaw is the problem. This is the issue with a lot of industries, and I think this is where you've gone different. They stick to their specialism and they don't go, they don't almost cross the line. The lines are set and they stay within that. Whereas health is holistic. So if you're a dentist, you should probably be looking at people's alignment, even though it's not your, necessarily your thing. But, and I guess after that, he's probably sent a load of clients to you along the way. Yeah, I can see, maybe you taught him to notice things and send them my way, and I'll fix it for him.
Yeah, he's certainly sent lots of people to me over the years, and now I've worked with other dentists as well, but I don't just specialize in like the neck and the jaw, the shoulder, the spine. I also do knees, ankles. No, so I'm trying to fix somebody in one session. I'm not just trying to fix what they've come in with either. So if they've come in with one problem, I'm also looking at what else is going on in their body that's causing them problems or could cause them problems in the future. So I'm trying to correct those issues as well.
Do you find that one thing can lead to a barrage of other things? So knees out slightly, which can then lead to your hip being up and then your spine's twisted, and because I'd imagine, I mean, I'm no expert in this, but one thing slightly out, you're compensating with other things. And then, you're not just a body full of bones, you've got ligaments, you've got nerves, you've got the lymphatic system. So if anything's sort of being pulled slightly in the wrong direction, I'd imagine it can really kind of propel up, up and around the body to cause other tensions and stagnations and aches and pains and all of this.
Yeah, exactly. Like knee, particularly with knee problems, quite a lot of people end up with hip and groin problems or lower back problems due to the knees being sore. Now, and it's fixing everything rather than just fixing the one thing.
Comes in with headaches, it can go even further than just the jaw. It could be.
It can be emotional. It can be psychological, trauma based. No, it's no. I went to treat somebody once, and they came in for a realignment. I went to put my hands on where the problem was, and their whole body jumped. So I had to step back and ask questions of them. I use what's called clean questions, and so that to build up sort of trust, but also to open their mind to sort of get down deeper into what the problem was, so that I could make those physical adjustments to the body that needed to be helped, but I could also work on the trauma at the same time that was causing some of the physical and emotional pain. So I'm quite lucky that I can do that.
Is that something you were searching to do, or it just kind of happened with a patient and then you've sort of ran with that, or delved into it more?
When I first, I was quite lucky when I first trained as a therapist. I became friends and worked closely with a guy called David Grove, who created Clean Language, which he used for sort of for trauma with Vietnam vets and Gulf War vets and different things like that. So I worked closely with him doing body work while he was asking questions of the mind and body. and I've kind of taken over some of that work since David passed about 10 years ago. So I still do that work regularly, but I don't do it in the clinic anymore because it's just too time consuming. It can take like up to 3 hours of my day, plus it wipes me out mentally and physically, because it can bring up childhood traumas, it can bring up abuse and different things. So I try and do it outside of the clinic now.
Yeah. So would you say quite often then the body can almost store trauma away, which is just sort of sat there for however long, just, I don't know, causing other problems and going rancid almost, just fermenting there?
Well, yeah, I've dealt with several people over the years. There was one lady that came to me for a shoulder problem, and her shoulder was physically in the wrong position. I fixed that, but she was still getting the shoulder pain. So ended up doing 3 sessions of what I call clean touch. It's clean questions with some body work, and it wasn't until the 3rd session that we found what was actually the stimulus for that shoulder pain, and she'd actually forgotten about the incident, or she'd put the incident out of her mind and had thought nothing of it. That was something that had happened when she was 18, and she was in her 40s when she came to me. But now our bodies are good at hiding stuff away from us.
Jesus, you just wouldn't know this unless you was lucky enough to come across someone that knows what you know. People could be asking questions for their whole life without actually coming to that conclusion, because it's quite a wild one, really. A lot of people wouldn't even believe it.
Yeah.
Jeez. Okay. I know that, I mean, through other people I've followed over the years, that are into, say, detox, let's say. So they've lived in a moldy house and they've got mycotoxins, like I said earlier, stored in certain parts of their body, or mercury is another one. And it can cause pains and almost like a oversensitivity of the central nervous system. And once they start detoxing, they release a lot of emotional factors as well. So a lot of trauma. So
Yeah.
maybe what you're doing there is you're kind of getting in there and just releasing this, would you say, stored up energy? I mean, how does that work? Is it on a spiritual level, or is there actually, do you think there's something that is more physical there?
The thing is, people store different stuff in different areas. Now, it's hard to just say, no, this is where everyone stores trauma, because no 2 people are alike, so they're not going to store stuff in the same place. Some people are very they're very much in their own heads all the time, so with them it tends to be somewhere sort of throat or above, that they'll have the trauma stored. So it can actually be deep inside the brain and stuff. Obviously, you can't manipulate that. But you can ask questions of it. You can dig deeper. The reason I like using clean language, it's the whole idea is that it takes away any assumptions from me out of the equation. I'm not trying to sort of force the person in any direction. It's more an exploration. It's going in, asking some subtle questions like, what kind of is that? Or is there anything else about that? And getting the person to open up, using their own words to make questions up, so that you're not altering what they've said in any way either. And I find it so powerful. It's it can be so life-changing as well. I went to do a massage. I don't do massage anymore. This is a few years ago. I went to do a back massage on somebody, and I just went over, chatted to them, put my hand on their back, and they burst into tears. And it turned out that I'd put my hand on the exact spot that that person's father had punched repeatedly over the years. So a lot of her pain and anxiety was in that spot.
Wow.
Even though it'd been years since her father had actually punched her, the pain was still there.
So you never know what you're walking into with a patient, then scared to touch him anywhere, just in case we have this whole explosion of energy.
Yeah, it's wonderful, but it's also quite scary. It's good that I've got the tools that can help people. It kind of annoys me that there isn't more people out there that can do this kind of work.
Yeah. We spoke before the call about also the lymphatic system as well. Do you do that as, or have you in the past sort of looked at, I don't know, clearing people's lymphatic system as like a separate service, or do you find that, you know, you might find someone that has pain somewhere and assume, right, you probably need to, you know, do it, whether it's massaging or people tap as well, or rebounding's a thing that people do as well. Is that something you come across a lot?
Yeah, well, not with lymph. It tends to be sort of, acupuncture works quite well on the lymph system. Lymphatic massage works really well. So I'm not an expert in. I used to do lymphatic massage, but I wouldn't class myself as an expert. So I'd direct somebody to another service, whether it's acupuncture or lymphatic massage, for that issue, rather than come to me. I'd fix whatever I could on them, and I'd do some stuff to get the lymph working and draining properly again. But I'd really direct them elsewhere, because I know that my limitations. Yeah. So if there's something that somebody can do better, I'm happy to pass them over and send them elsewhere. I don't expect to be able to do everything for everyone.
Yeah. With regards to the lymphatic system, I mean, what sort of signs and symptoms do you come across that would suggest there's a problem there? And also, I mean, what's the potential ramifications of having a lymphatic system which isn't draining properly? Because I know that a lot of the body's toxins are sort of flushed through that system. So, I mean, how bad can it get if somebody is clogged up?
The skin becomes very tender to touch, swelling around the joints. It can be extremely painful, and now there's quite often a lot of heat produced as well. Inability to sweat and things, because because the glands are blocked. They're not allowing the correct flow of through the body, so the skin's not getting the nutrition and stuff that it should get as well. It lets us open up for viruses and infections, because the white blood cells travel around the body within the lymph system.
So it can be almost like a factor of 1,000 different things.
Yeah.
Okay. Do you? I know you said you're not an expert in terms of maybe the drainage side, but you do have experience. What do you think of things like these little rebounding trampolines and stuff? Because I guess it is fluid, right? So you want to, a plate, shaking plates and things like this.
Yeah, vibration and stuff can help, and things that can stimulate are useful. That's why, like, acupuncture has been traditionally used for decades, well, centuries, for the lymph system, as well as massage. Certainly, those two would be my go-to, rather than, because even though the trampolining is creating some vibration and stuff, it usually isn't sufficient to actually clear everything. It'll actually work more on the blood. It'll work more on pumping blood to the muscles rather than actually working on the lymph, the rebounding and stuff.
So do you want to get in there, with a massage, and tap in as well is another thing that, say, if you want to do it at home for yourself?
Yeah, and I'd always would encourage doing things like ice massage and stuff as well. Now, just rubbing ice cubes over the area to reduce the inflammation that's there, increase the blood flow to around the area, and also sort of help clear the lymph. Because small circular movements with an ice cube will do wonders for the body. It takes away the swelling. It gets blood flowing. It helps clear the lymph. Now there's lots of little things like that. Tapping, because it's on the surface of the skin, and you're creating some working the myofascia that will help clear the lymph as well. I know a few people that do tapping, but it's not something that I know a lot about.
Is there any sort of order of service you would say? So if, say you're getting, I don't know, inflammation in one area where, the lymphs will go, the system will go through. Would you say just get in that area, or is there, because I was watching this one guy and he was saying, I think the order, there was 6 points, and he was saying, I think it was the collarbone first, both sides.
Yeah.
It was going up to around here, then under here, then the belly, then the groin, and then behind the knees. Is there any sort of order that you would suggest, or you've come across in your experience?
No, certainly when I did lymphatic massage and stuff, it was you started with arms and shoulders, then did legs, sort of fronts and then backs, and then do the back and the neck last. But that was the way I was taught. Like I said, that was 22 years ago. It was, and there's a girl that works for me that does lymphatic drainage now, and she does it completely differently because it's a very light touch now. She was trained to do a very light touch, whereas when I was taught, it was very heavy, very manual, sort of getting right down into the muscles to increase the blood flow, and strong, heavy strokes to get the lymph flowing. Whereas now, because the lymph's only just under the skin, it's doing light strokes to get it now. So things have changed, and the thing is, things need to change. That they can't always be kept the same.
Yeah, I know a lot of people use like dry brushes as well, which I guess would give more credit to what your the lady is doing it with you. It's just that sort of brushing lightly and working it, I think, towards the heart as well is
you always work the lymph upwards. You always work up towards the next lymph node. So you start with the lowest lymph node and work up towards the heart.
You mentioned acupuncture, and obviously the sort of work that you do as well, the emotional sort of release, I guess. I wonder if that happens in acupuncture as well. I wonder if there's like a specific spot, because obviously they're looking at the whole body meridian. There's like one spot that's like energetically blocked, and once you get in there, it unleashes all of this stored up trauma from like decades ago.
Well, from my experience of acupuncture, it's again, it's usually more than one spot. And now, so with working through meridians, they're working on multiple spots all along to clear the channel, is my understanding.
Yeah. It just makes you think that and this is why I think people like you are busy, and as more and more like people start to, I don't want to use the word wake up, but start looking at things slightly differently, not how the allopathic medical paradigm tells us, which is, everything's individual. It's like compartmentalized. And I think it just proves that we are a whole, and everything's interconnected in, so many different ways. Like you've got now, it's coming out, this link between women who have had, say, a root canal and breast cancer, and stagnated lymph flow and all of these things. So you go in and these guys are just treating a symptom and understanding what a symptom is, and only that it's a symptom. It allows you to look at things a bit deeper, and then but there's not many medical professionals out there that are looking at things as a whole. You've been diagnosed with something. Okay, let's talk about your childhood. What trauma have you faced? Let's have a look at your meridian. Let's have a look at your teeth. Teeth are a big factor. Have you had any root canals? What's your appetite like? What's your home life like? Do you like your job? Do you hate your life? There's so many factors that
there is.
You almost have to take it upon yourself at the moment, but I think things are going to change. I think there'll be more and more holistically minded people, that can actually make a career out of it. People are out there working holistically, but is there the market for it yet? Well, I do think as times are growing, and this is what this podcast is really about, is looking at the whole. People will, instead of going to this person that does that, this person that does that, this person does this, I spent a fortune going around the houses, I can go to someone that understands this, and we can have this honest conversation. It's more like an investigation, as opposed to, cleared that symptom, see you later, you're fine.
Yeah.
So, okay, interesting. Is there anything else, because I know you're a bit strapped with time, is there anything else that you wanted to specifically go into, or are you pretty happy with, what we spoke about?
No, I'm pretty happy with what we spoke about. I think we've covered quite a lot.
Yeah, perfect. Okay, do you mind just telling the audience? I know at the beginning of the call you said about where you are, and what you're doing. Is there anything that you're doing in the future? Any conferences, exhibitions, or any other interviews like this that you wanted to?
Well, my next conference that I'm at is Northern Taste of Clean, which is 27th of, I think it's 27th, 28th of July in Sir Caldy. I'm not quite sure what's happening after that.
Yeah. Okay, perfect. I'll share a link to your website and any social media on this podcast anyway, and hopefully we'll spread the word on what you do and what you can offer. And I've found with probably quite a few actually of the interviews I've done, I've had comments where people have just stumbled across it. It's weird how the world works this way, and they're like, oh my god, this has actually answered questions, and then they've ended up contacting the person that I've interviewed, and we've managed to fix somebody. So if that's kind of all I offer to the world, just to connect a few people, I'm pretty happy with that. So we'll share that, and hopefully we spread the word, but not too much that you can't, you're well over your capacity.
Well, thankfully I've got 3 girls working for me that can do what I can do now, so That helps a lot. That's taken quite a burden off my shoulders.
Yeah, because I know you're working pretty much 6 days a week, aren't you, as well?
Yeah, I work 6 days a week. This week I'm working 7.
Oh, brilliant. Well, appreciate you finding the time for me, and thanks for all the work that you do.
Okay, thank you, Jay.
Cheers.